Hi, Dr. Lucky Seacon, board-certified OBGYN and fertility doctor. I want to talk about this recent headline reported on in Glamour magazine about Keisha the singer, who just underwent an egg freezing procedure this spring and says that she almost died from a very rare complication. So I want to take this opportunity to talk about the potential complications of an egg retrieval. An egg retrieval is the first step to egg freezing, embryo freezing, or IVF, and it involves undergoing an ultrasound while you're under anesthesia with a needle guide attached to it, and under ultrasound guidance, we go directly through the corner of the vaginal wall, directly into the adjacent ovary, into each bubble of fluid or follicle, and we drain the bubble of fluid to pick up the egg that's floating inside. Because the ovary is in such close proximity, and this is actually not accurate, usually is hugging the vaginal wall, it's really easy to do this quickly and in a simple, minimally invasive way that is low risk. The most common thing to expect post-egg retrieval is to have mild abdominal pain or cramping, and this is generally well treated with over-the-counter medications like Tylenol or Motrin, and it should subside the next day or within a couple of days. Anytime you do a surgery, we always talk about potential complications. These are rare, but one potential rare complication of an egg retrieval is that there can be injury to surrounding organs like the bladder or the bowel or rectum, because the vagina and these other structures are in close proximity. This is rare because we're doing the procedure under ultrasound guidance, and we're generally speaking working down here and avoiding these structures, and we can see where the needle is at all times. Another rare but serious complication is the risk of bleeding, either directly from the ovary itself or from injury to any of the surrounding blood vessels. And there are a lot of surrounding blood vessels, but again, this is why we do the procedure under ultrasound guidance, and we can even use Doppler flow to really accurately detect where the blood vessels are and to avoid them. This is extremely rare. Less than 1 in 1,000 egg retrieval cases are complicated by bleeding. The last potential rare complication of an egg retrieval that I want to talk about is the risk of infection. We're working in the vaginal canal, which is not a sterile environment, and we're passing a needle through the vaginal wall into the pelvic cavity. And this is why preemptively many doctors will give their patient a dose of prophylactic antibiotic to be taken the night of their egg retrieval to cover them and protect them from this risk of pelvic infection. However, this isn't considered standard of care to give prophylactic antibiotics the day of egg retrieval, because there are many studies that show the risk of infection as a complication after an egg retrieval is quite low. Most studies are quoting rates of less than 1% chance of infection. This might be more pertinent or a higher risk for patients with pelvic adhesions, history of pelvic inflammatory disease, or history of issues like endometriosis. And oftentimes, if we are close to an endometrioma at time of egg retrieval, we will ask the anesthesiologist to give an IV dose of antibiotic to cover them for that. So getting back to Keisha and the complication she went through after her egg retrieval, the article remains very vague, but it states that she had a rare but serious complication that was attributed to her underlying immune deficiency disorder. So I'm guessing that she had a complicated infection, and she's probably predisposed to this by the fact that she has a weakened immune response and was unable to clear whatever bacteria was introduced into her pelvic cavity. Bottom line is that for patients with no predispositions or risk factors, egg retrieval is a very low risk, low complication procedure that is minimally invasive, and it usually goes off without a hitch. But it is important to be aware of serious complications that can occur, and if you have any underlying disorders that predispose you to infection, bleeding, or injury to other organs, talk to your doctor about ways to minimize the risk.